Welcome to Living Healthy Chicago. I'm Jane Manzuris. We're starting today's show by talking about something that can completely rock someone's world: cancer. It's a battle back to health physically, but it's equally important to address the emotional side of that diagnosis. This next woman says art therapy is what helped her handle that aspect of breast cancer. As it does for many women, Connie Kubik's experience with breast cancer started with the discovery of a lump.
I had a mammogram and an ultrasound. Once they did the biopsy, then it proved to be invasive lobular carcinoma. I was petrified. I was terrified. I was extremely nervous. All I did was cry.
She had a lobular breast cancer, which is one of the two most common. It originates from the lobules in the breast tissue. The stage were localized, which is great, which means it hadn't spread. Breast cancer is cells in the breast, generally in the lobulars or ducts, that have gone out of control, for lack of a better term. They started to grow more than they should. 1 in 7 to 1 in 8 women in the U.S. get a breast cancer at some point in their life. So it touches almost every family in the U.S.
I felt I had a death sentence. He said, no, this is totally treatable. So we went from there.
Connie went on to have a mastectomy, followed by radiation.
Good morning, Connie. Good to see you. Radiation reduces the risk of it coming back by actually making the cancer cells unable to divide and to improve survival.
Radiation was kind of tough. All of a sudden your emotions come out. They get pushed back a little bit during the process of all the physical aspects of a cancer diagnosis.
Connie found out that what helped her process those emotions was art therapy.
It, at times, brought out emotions, and at other times I would get just immersed in the art.
Art therapy is the use of art making within the therapeutic relationship. There's a belief that you may not have the words to describe what's going on internally, and so we use the art to kind of express those emotions. Different media can evoke different emotions. So sometimes I might encourage a patient to try something different.
If you look at some of the art therapy data, it actually reduces people's stress levels if they're into it. So I think that Connie got a lot out of it, actually, that kind of support.
Beth says another benefit of art therapy is that it puts choice back in patients' lives.
I didn't even talk about it or think about it.
I think that so many choices are taken away from an individual when they're going through an oncology diagnosis. So when I can infuse choice for patients, I really like to give them that opportunity. I think that it gives them control over something within the situation and gives them a grounding place.
She always gives you options, so if you're working on a project, you can tell her, I don't like it, I want to work on something else.
Taking care of your emotions, taking care of how you're thinking, how you're doing is really important. We want people to live as long as possible, but also live as well as possible.
After successful treatment aided by art therapy, Connie decided that she wanted to make art an ongoing part of her life.
Cancer pretty much was the door opening to get back into art. There's quite a few things that I want to try. I like to attempt drawing mountains because to me they symbolize strength, majesty, and it's like, wow, I made that. It's fun.
Connie and her care team hope that her story will remind others going through breast cancer to seek out support for their emotional well-being as they undergo treatment.
It's a shock to the life. It makes people really nervous and concerned. The more supportive things, the more things we can do to help life go on, because life goes on, the better it is.
I feel good physically. I lost a breast, but that isn't what defines me. Being healthy and continuing on with life is what defines me.
Do you want more Living Healthy content? Well, check out these videos right here, and then subscribe for more right here.